for most children, that is always our starting point. Diet, gut, detox, and drain.
Here at Michigan Family Wellness, we believe chiropractic care and nutritional-based therapies are a foundational part of a healthy family lifestyle. No matter where you're at in the mitten, having a family is such an exciting time of life. So instead of feeling overwhelmed by stress, fatigue, and responsibilities with the kids, we invite you to become part of this empowering community to create happy, healthy families. By providing engaging interviews and practical applications, Dr. Wallner cultivates family health by equipping our listeners with the tools they need to elevate wellness in their own family. Dr. Wallner passionately serves the Michigan community at his chiropractic and nutrition-based practice, where he specializes in pregnancy, pediatrics, and family wellness care. And now, here's your host, Dr. Kyle Wallner.
Good day, everyone, and welcome to another empowering episode of Michigan Family Wellness. I am your host, Dr. Kyle, and I am really looking forward to today's interview with Dr. Sue McCready. This is the first time we've ever had an MD on the podcast, so I'm really looking forward to the interview today, guys. You know, we're going to talk a lot about pediatrics and family today on the podcast interview. And just to let you guys know, we do have chiropractic care for pregnancy and pediatrics coming up live on Saturday, July 16th at Canton Summit on the Park. So in the interview portion for today, we're going to talk a lot about kids, especially young kids, pediatrics, teenagers. They all respond so well to chiropractic adjustments and to chiropractic care because here's the thing, they're not skeletally mature yet. What you do when your kids are young, all those falls, those can profoundly affect how you move and how you experience life later on when you reach the age of 25 and you become skeletally mature. So as I talked about with Dr. Stephanie Mage a few weeks ago, you need to remove that neurologic central nervous system interference. And one of the best ways to do that is with chiropractic care, specific, gentle chiropractic adjustments. All right, well, before we get to the interview portion of the show, let's introduce Dr. Sue. Susan McCready, MD, aka Dr. Sue, is a board-certified pediatrician specializing in helping children who have fallen through the cracks of modern-day medicine. With over a decade of experience and study, she's developed a system with nutrition, herbs, and homeopathy to help children heal from allergies, asthma, attention, autism, and most chronic childhood health issues. She's passionate about helping children who take daily medication to control their symptoms, and especially those children where no medication can fix their problem. She created Dr. Sue Health SoulFULLY online magazine to provide you with tools to nourish your health soulfully. She is the founding president of the 501c3 nonprofit GetRealForKids.com, a community of board members, volunteers, moms, dads, teachers, practitioners, celebrities, and chefs who are dedicated to helping kids eat more real food and heal from the inside out. So, without any further delay, let's jump into the interview. Welcome to the podcast, Dr. Sue. It's so great to have you.
Thanks for having me, Dr. Kyle.
Absolutely. You know, I just keep thinking back about, your name has just come up in my practice, over at the office and kind of in my life so much. But it was so great to finally put a face with the name down in California last October at that major conference we were both at. So I just wanted to let you know I really appreciate you coming on the podcast today, and I just really appreciate finally establishing that relationship down there in Santa Barbara.
Oh, thank you. I'm grateful to be here. Truly, I am.
Yeah. So I've just told our listenership a little bit about Dr. Sue as the professional, but can you give our listeners an idea of what family looks like for you right now?
Sure. I'm a mom of 3. I'm married and a mom of 3, so life is busy.
It's awesome.
And my oldest is 11, my middle is 9, and the youngest is 6. So they're all girls. So we have a lot of estrogen in the home.
So you got your hands full.
We got a lot of emotions flying, which is good. It's good, it's fun, and it's really busy. So 2 are in grade school and 1's in middle school. And I love all the ages. I truly do. I never thought about the older ages. When I wanted to be a mom, all I really thought about was the little baby and holding the little baby. And I'm a pediatrician, so I love babies. But I do love all the different ages too, the different developmental Tweens, I don't know if I love yet. We'll see.
I got this from Derek Weber, and I've mentioned it on other podcasts as well. But would you agree with the saying, when you have kids, I'm sure when you have 3 as well, the days become longer, but the years become shorter? Would you resonate with that?
Yeah. I would definitely agree with that. Time is flying by and days are really full. And trying to really enjoy the moments. They're all squeezed in between a lot of messiness,
Awesome. Well, that's one thing I love doing here on the podcast, being all about Michigan families, just to have, someone, a real family person on the podcast to provide those value and benefits to our listenership. So another thing I love to say here on the Michigan Family Wellness Podcast is that we're smitten with the mitten. So I always ask my guests to share what they love about Michigan, or perhaps not love.
No, I do love it. I'm born and raised in Michigan. I tried my hardest to get out for med school, and I didn't. And then I tried really hard to get out for residency, and I didn't. And then during residency, I met my husband, and he's with the car companies. So we're here.
Awesome.
We're here. But I do have to say, we live in Ann Arbor, Michigan, and I am such a fan of Ann Arbor, Michigan.
Yeah.
We moved my practice here about 9-10 years ago, and we moved my family and the practice here, and we are just overwhelmed by the community. The community here is just amazing. It's a great fit for us. So
that's fantastic.
That's where I'm smitten for the mitten, this Ann Arbor, Michigan.
Absolutely, Sue. I can definitely relate to that love for Ann Arbor. Being from Ann Arbor myself, Pioneer High School, going into downtown Ann Arbor all the time. Just such great memories, growing up there in my earlier years. But actually, Dr. Sue, let's go ahead and jump into what we're really here to talk about today. So my listeners understand that you're a medical doctor. You have this awesome holistic pediatric practice in Ann Arbor. Can you tell our listeners more about that and how that elevates family wellness?
Sure. I mean, I can definitely start maybe with just how I even evolved into becoming a holistic pediatrician.
Yeah.
There's not a lot. There weren't any when I finished residency. So what happened with me is I was doing my pediatric residency at Children's Hospital of Michigan in Detroit. And I stayed on an extra year as the chief resident. And during that time, I was really exploring alternative medicine. I first started with something called cranial sacral therapy. And I had to get a job, a job. The chief residency was ending, and I had to figure out what I was going to do. And so I sent out a letter to a bunch of holistic practitioners at the time to see if anyone would hire me. And it turns out no one would hire me, but one DO said that I could open up shop out of his office. So that's how I started, and that was 14 years ago. So I was initially like a primary care pediatrician because that's what I was trained in. But as I gained other certifications and training, I evolved to be a consultative holistic pediatrician. So all the kiddos that I see have another pediatrician to meet their primary care needs, and then I help them heal and rebalance through nutrition and herbs and homeopathy primarily. So it's been a journey. I've learned a ton, and I love what I do. Most of the kids that I see basically kind of fall into two groups. Either they're on medication and they want to get off, or there really isn't a medication that solves their problem, so names that I would see would be allergies, asthma, eczema, ADD, ADHD, autism, lots of autoimmune problems, chronic headaches, digestive issues, lots of anxiety, sleep problems. So all the things that kind of fall through the cracks of standard medical care is where my practice thrives. And I love it. It's really fun.
That's fantastic. And I think there's such a great pairing between, what you're offering people out in Ann Arbor and just the whole idea of aligning the spine, chiropractic adjustments. I talk a lot about this on my podcast as a chiropractor myself. But when you can combine those things that you're talking about, that physical medicine, those homeopathic remedies, and you can combine that with having a central nervous system that is specifically tuned for that person's body. I just really think that you can, time travel and accelerate those results with your healing, on many different levels, whether it be physically, mentally, spiritually, emotionally. And so, yeah, like I said, I just think there's a real collaborative effort there and effect for our listeners.
Yeah, a lot of patients in my practice have a chiropractor that they see pretty much on a regular basis. So they definitely incorporate that into their healing plan.
Fantastic. So, and just to be clear for our listeners, so are you prescribing medications actively, or you mentioned like helping people work off the medications?
Right. Sometimes I have to prescribe medications, but rarely. But I do when I need to. And most of the kids that I'm trying to do is help them get off the daily meds that they're on or wean them to a lower dose. Or unfortunately, there's a lot that there's no drug of choice for a lot of these conditions. So that's why they walk through my door, basically, because they've already tried a lot of different things without resolution. So we really focus a lot on, there's three, I sort of take them through the basics of healing the body on a physical level is all about diet, gut, and detoxification and drainage. So those three components, right? Like you have to eat food that's fit for you, that doesn't irritate the rest of your body, like the immune system, nervous system, gut. Then that food goes into your digestive system, and your gut has to be able to digest and absorb and get all that nutrition into the cells to feed the rest of the body. And then the third part is that we have to release what no longer serves us. So that's the whole detoxification and cleansing process. So those are like the three main components that I really focus on with kids. And, it's really true for most children, that is always our starting point: diet, gut, detox, and drain. So,
Dr. Sue, you bring up such a great point, and I'm so glad that you're out there kind of in that Ann Arbor community and able to serve people in this way. Something that I see in my office a lot is people trying to do exactly what you're saying, but they do it at the wrong time and at the wrong level and kind of in the wrong sequence. So essentially what they're doing is they may see like a detox or a cleanse or something like bone broth. It could be helpful for you, but if you do it in the wrong way and if you do it at the wrong time, it can actually make you worse and cause a healing crisis. Would you say that you see any of that in your office?
I do see that in my office, and I coming, that's happened to them before they came to my office. And honestly, I used to put a lot of people into healing crisis before I learned the order. But that's part of the learning process, is that, yes, you really have to get the diet squared away first and get the gut healing before you really push the detoxification too much. And that is a journey, and that's with the patients. It takes a lot of patience, because a lot of families come in and they know that their kids, they have a lot of knowledge. My parents are really educated, and they've usually done a lot of work on their own health, right? So they've come in with a lot of knowledge, and they're always worried about the gut imbalance and wanting to kill off these organisms and get rid of the yeast and get rid of those parasites. But I always go back to the fact that we really need to feed the army first. The army is like flat on the ground, wiped out, really tired. And we need to feed the army first and get them standing back up and ready to fight the fight before we go down there and start, killing off organisms. Otherwise, it really sets kids back. And it's still a delicate balance. You can still think a child is ready to move in that, and then you push them and they fight, they show you that they're not ready yet. So then you just slow it back down. I mean, I always describe health as balance, like a child on a teeter-totter, standing over the pivot of the teeter-totter. And when they're happy and healthy, they're balancing themselves back and forth. And when they're stuck in dis-ease, they're imbalanced. It's like someone sat on the left end of the teeter-totter and they can't adjust themselves to balance anymore. And so what I do with diet, nutrition, and homeopathy is that I'm really trying to drive down that other side to help them rebalance. But I can be part of the problem too if I stress them too much in that healing process. So you'll learn as you go. You keep your eyes open and see what the child has to say back to you. So it's fun.
Yeah, and I love that analogy of the teeter-totter. I remember reading that from your Health SoulFULLY digital magazine. Is that right?
Yes. Yeah, that's issue 1. Mm-hmm.
Yeah, and I would just really recommend everyone check that out and, read more about that analogy that Dr. Sue is using. But definitely what you're saying, I really recommend that people work with a professional, work with someone like Dr. Sue, like myself. We know what we're talking about. We've been to graduate school. We've passed our board exams, and this really makes a big difference when you're talking about creating a healing crisis versus just trying to, figure things out on your own, and you could potentially make yourself worse, like we were saying earlier. So highly advocate for the wealth of knowledge and resources that are being available to you on this podcast episode. So speaking of your digital magazine, Dr. Sue, can you tell us more about that?
Sure. So Dr. Sue Health SoulFULLY is basically came out of my passion for health and wellness, but also spirituality. And so my journey through medicine has been that first you learn about the physical, and in my MD specialty, it's really about disease. And then when I ventured off and started the practice is really where I learned all about the holistic component on the physical level, sort of what we just talked about, the whole balancing act, and using nutrition and homeopathy and herbals to help rebalance the body. Mm-hmm. And then there's the whole mental aspect where a lot of people now too are recognizing that complete breath is really important for balancing the nervous system, and yoga and meditation, right? And that's where I call it's quieting the mind, things that you do to quiet the mind. So it could be meditation, yoga, prayer, journaling, anything that you use to quiet the mind. Could be play. Well, play is very important. Like I was seeing a teenager in my office the other day, and I was like, what brings you joy? She's like, I don't know. Like anything, right. Anything. What brings you joy? And she struggled and she struggled. And finally she looked at me and she's like, dance. I love to dance. I was like, then dance every day. She says, I go to dance Tuesday, Wednesday, and Saturday. I was like, you need to dance every day. It's not for anybody else. It's for you. That's what makes you happy. And that's about just connecting, right? And really quieting her mind and doing something that brings joy to herself. The spiritual aspect, it's not religious at all. It's really just about connecting with spirit and what it means to be spiritually healthy. And so on my journey, I've learned about, how being spiritually healthy just means that you're multisensory. It's learning how to see, hear, and feel and know the divine presence with you every day. And so most of us kind of walk through until we've come to that place where we realize the divine is present with us. At any moment we choose to tap in, we kind of live in an overwhelming world, more of like a fear-based world than a love-based world, especially with parents and kids in my practice, right? And I'm sure in yours, because they're in difficult situations and the difficulty can feel very overwhelming. But once you connect with the spiritual aspect of that, which is the universe is working for me, not against me, despite X, Y, or Z happening right now, or despite my child having X, Y, or Z, right? The universe is still working for me. How is the universe working for me, right? And so that is where I think healing resides. When you really help a person or a child get to that space, it's a complete turnaround in their health, I think. That's what I've experienced. I don't know if you've experienced the same in your practice.
Dr. C, you bring up such a great point. And, there's so many firsts right now with this episode on the podcast. I mean, you're the first medical doctor that we've had on the podcast, and you're really the first person to hash out some really foundational, practical applications in terms of addressing that spiritual or that soul framework. So just for our listeners, we've established this, framework or this concept of body, mind, and spirit. There's all these different things that affect our health, toxicity, deficiency, and I see this a lot in my practice, especially with the upper cervical spine. C1 through C3, that relates to a lot of confusion, endless inner chatter, rejection of wisdom, not really being confident with yourself, indecision, guilt and repressed anger. And so what I see, back to you were saying, is when you have these chronic subluxations or these chronic misalignments of the spine, it doesn't do much sense philosophically, to just keep adjusting those same parts of the spine. And even when we've done all the nutrition and the homeopathy to support those reflexes as well, I really think it's important for people to, address these areas of their spirituality and their soul in their life. So turning this back to you, Dr. Sue, in the same way that I wouldn't, let's say someone needed medical attention, they're sick, they may have a raging infection. I wouldn't necessarily tell them to go to a pastor, or a priest or anyone like that. I would say, go to a medical doctor. You need to be checked out medically. So just to help our listeners understand, are you saying that, if you're someone that identifies, that resonates with what you're saying, I really need to figure out some of these spiritual aspects, some of these soul aspects, should I be going to see, Dr. Sue for consultations, or how does that work?
I think, for adults or children, right, when you get to the spiritual aspect of health, it's really about quieting your mind. It's really about setting the intention. Your intention is that you want to be spiritually connected, that you want to know that there's something greater than you at play here. And then you use practices that help you quiet that space so that spirit can connect and enter in. So those are complete breath is probably the easiest one that I've ever learned. And you can do it. I teach kids to do that all the time, where you just, what I'm talking about. You inhale, 1, 2, 3, you hold 1, 2, 3, you exhale 1, 2, 3, 4, and then you repeat that. And you try to slow it down, like exhale even longer, 4, 5, 6. And that quiets, and balances the nervous system. That's probably the easiest thing to do. I do it all the time for myself. Like when one of my girls sets me off at home.
Sure.
Or even in the office when things get a little crazy, right? It's a way for me to reground, recenter myself and connect. That's probably one of the easiest practices. Meditation is another daily practice that I use for myself. And yoga, I love yoga. And some kids love yoga too. Lots of adults love yoga. I love yoga. So meditation and yoga. Journaling is probably one of the most profound things that have allowed me to connect with spirit, in that the practice, I don't know if you're familiar with Julia Cameron's book title, which I'm going to forget, but it's all about cultivating creativity and that the creator is within all of us. And one of her primary things is, she calls it morning pages. I call them brain dump pages. Okay. But every morning you get up and you fill 3 pages in your journal, even if it's like, I don't know, I feel like crap, I'm tired, I'm hungry, I've got this, that, and the other thing to do. Johnny has to do this today. How am I going to fit that tomorrow? You just, for everything that's on your mind, you're just dumping your brain down. And at some point, usually what happens is creativity strikes. Something divine comes in. Something you're able to see the situation in a different way. That's happened to me so many times. And then you just start getting curious and asking a bunch of questions. And really divine thoughts will come through. So you can solve a lot of problems that way. And I always ask parents to do that, especially for their children. When you're confused, when you don't know which direction to go for your health or for your child's health, sit under that tree, sit under the Buddha tree of wisdom, and just get quiet and start getting curious and asking questions and see what happens, see what comes to you. Because you're I always say this to the parents, like, you're the best guide for your child. You've known them when they were a thought in your mind. And so regardless of all the practitioners that integrate in your lives, you're the best guide for them. And just get really quiet and stay focused in love and not fear, because that's the problematic part, is when our fear goes into overdrive. So those are really practical. And then prayer, like a lot of things, simple prayer, and it's not complex. Prayer for me is like a running conversation. It's like a running conversation with a best friend all day long.
Absolutely. Easy. So, Dr. Sue, I'm listening to you lay down all of these amazing practical applications. You're actually kind of getting ahead of me here. That's one of my questions towards the end of the podcast, but I really appreciate, everything that you're equipping our listeners with. And as I'm just listening to you talk here, I'm just trying to establish, this big picture framework where it seems as like, as adults, we get so stressed out with, our lives, our jobs, our relationships. Like, we accumulate so much stress. And what I hear you saying is, we need to go back to these just basic fundamental things that help us, as you say, connect to spirit, and then communicate that to the generations that come after us. So our kids and our grandkids and all of that. Would you agree? Is that accurate?
Yeah, absolutely. And the things that I sort of keep the framework in mind is that it's balance your body, quiet your mind, and open your heart to connect with spirit.
And
those are the three main things. And it's really easy to teach your kids. One of the things that I've taught them is the breath, just slowing down your breath. And it's really fun to see them put it into action when, like it happened the other day when we're running late for school, getting to school, and the youngest one is really struggling to get out the door, and the middle one is getting frustrated. And then you can hear her start breathing. She's inhale, exhale. And it's really a glorious thing because it really, just her doing that calms down the whole situation, including me, because the rest of us are kind of revved up, right? But if even someone's doing that in your environment, it's amazing how it changes the whole scene. So kids are so amenable to learning these simple things.
Fantastic, Dr. Sue. And I know that people can go and read issue 1 of your digital magazine, Health SoulFULLY. Is that right?
Yeah, Dr. Sue, Health SoulFULLY. Yep.
Awesome. And what were those 4 things that you mentioned again? Like those 4 quick things or those 3 quick things?
Yep. So the framework is balance your body, quiet your mind, and the third is open your heart to connect with spirit.
There you go. Fantastic. Well, I love the value and the benefits that you're bringing for our listeners today, Dr. Sue. You've laid out so many practical applications already, so I don't really need to spend more time talking about that. But are there any other resources, I know you mentioned one, or anything that you really want to equip our listeners with that, that they should be listening to, that they should be reading, other than your Health SoulFULLY magazine, of course?
Right. I mean, if you go to drsuemccready.com, that's how you connect with me in terms of my practice and Dr. Sue Health SoulFULLY. And you'll see there also that I co-founded a nonprofit called...
I was going to ask you about that too, yeah.
Yeah, GetRealForKids.com. So we founded that about 4 years ago, and we're just getting close to launching our first program this fall. It's a menu plan program. And the 3 arms of GetRealForKids.com is that if we want happy, healthy kids, we're way off track. We need to get back to eating real food, healing from the inside out, and parenting our kids in connected ways. So it's food, health, and parenting. Like, eat food that grows as nature intended. Heal from the inside out instead of the outside in, like putting, bandages or, on our boo-boos, like treating symptoms with pharmaceuticals, basically. And the third is really connecting with our children heart to heart, looking at what's their purpose here? Why are they here? And how can we cultivate and help guide them in that way?
It's so great to have like-minded people on the podcast here, because we're all about families and elevating family wellness. And, this approach, exactly what you're talking about, getting back to real food, using physical medicine like homeopathy and nutritional supplements, and then at least in my office, pairing that with the chiropractic adjustment, that's just so in line with everything that we're about here at the podcast. I want to remind everyone that we're going to have a dedicated webpage at MichiganFamilyWellness.com with all of the show notes and everything that we've mentioned here on the podcast with Dr. Sue. And I want to also let you know, you can expand those show notes if you're listening on your mobile device. You can just tap that album art, and those clickable links will just expand before you, and you can take advantage of those right now. So everyone, Dr. Sue, she is a holistic pediatrician. She is an author. She is the starter of a nonprofit. She's a mom. She's a wife. Have I missed anything, Dr. Sue? Does that about cover it?
Those are my main hats.
Awesome. Well, thank you so much, Dr. Sue, for coming on the podcast. I really appreciate it, and best to you and your family and your practice.
Likewise. Thank you so much, Dr. Kyle.
And remember, we can do far more together than we could ever do apart. Coming to you from beautiful Southeast Michigan, I'm your host, Dr. Kyle, and this is Michigan Family Wellness.
Now that you've been equipped with the latest in family wellness solutions, we want to encourage you to apply these strategies right away. But the thing is, there's still so much to learn. Connect with Dr. Wallner's Chiropractic and Nutrition Office by going to MichiganFamilyWellness.com and click the newsletter sign-up button to join the informative and supportive community of chiropractic wellness. You'll also receive as a gift from Dr. Wallner a copy of Michigan Family Wellness Solutions, an invaluable resource containing dynamic tools to elevate family health and vitality. Michigan Family Wellness wants to thank you for being part of today's podcast. Please subscribe to our podcast on iTunes and give us a 5-star rating and review.